是邱伯恩专家。邱伯恩专家他是张滨秀妇纪念医院中医部主治医师，台湾扶针医学会，主治专长包括扶针疼痛治疗、老年退化性疾病、运动伤害、肠胃消化功能障碍、睡眠障碍、不孕症，擅长通过中西医结合疗法治疗各式疾病。他所要报告的讲题是应用扶针疗法治疗慢性膝关节周边软组织疼痛的临床研究。邱专家，请。
Good morning, ladies and gentlemen. It is a great pleasure for me to join this session at the World Federation of Acupuncture Exhibition Society in Singapore. So my name is邱伯恩. I'm a Chinese medical doctor in Taiwan, and I work in Zhangbin Xiuchuan Hospital. Today, I would like to present the result of efficiency of subcutaneous needling in treating soft tissue pain around the knee osteoarthritis. And our study was a randomized clinical trial. So our study performed with China Medical University by Professor Zhou Liwei, and Beijing University Professor Fu Zhonghua, and me myself. So at first, I will discuss what is a knee osteoarthritis, and I will then talk about the benefit of subcutaneous needling. So, and finally, I will describe our research, so about the methods we used and the limitation we meet in the clinical trial and the issues to be addressed in the future. So at the next page, we can see our published below in these 2 years. And you can be found in the Journal of Pain Research, and all of them except in October 9, 2021. This is another paper. So first we will talk about the introduction, and I will first talk about the osteoarthritis in the knee, and with the symptoms, and I will focus on the full subcutaneous needling, also named Fuzhen. So we know that osteoarthritis in the knee there are more than 15% people in Taiwan have OA knee, and we know that women are always at higher risk. And it was the third fastest growing cause of disability. So that's why we choose this topic as our for Fuzhen therapy needling. So first we need to know what is the symptoms when patients have OA knee. Many people have pain with activity, and both sides they will feel, and they may feel the limited range of motion. Some people may feel their joints with stiffness, and some with stiff joint swelling. And people may feel the knee tenderness when they get up, and some people feeling their knee may give out. So at last, they will get the deformity of their joint. Until now, there has no clear pathophysiological explanation for the pathogenesis of knee osteoarthritis. But we know that muscles are always essential to the knee OA, and we think that trigger points are common found in patients with their quadriceps or gastrocnemius or pescentinus. So trigger point may be found in muscles. That's why we choose Fuzhen needle to cure the OA knee. So our study, we observed the immediate 1 week and 2 week effects of Fuzhen therapy in the treatment of the OA. So you can see the picture. It's the Fuzhen needle, also named full subcutaneous needle. It was originated from traditional Chinese acupuncture, and it was produced by Professor Fu Zhonghua. In our case, in many cases, we can see that Fuzhen can provide immediate and significant relief on the pain in trigger points. So let's talk about our study, and we will talk about the materials and methods. And we will first tell about the procedure and intervention of Fuzhen and the pains. So you can see the picture. In Fuzhen group, procedure and intervention. We used a randomized single-blind clinical trial. So on the left side, you can see is the Fuzhen needle. And on the left side, you can also see that's the insertion point for Fuzhen needle. We choose the quadriceps because there is a lot of trigger point inside we found. So on the right side, you can see that if we use the insertion point as use Fuzhen needle, we studied that a swelling movement on this side. And after insertion, we use the dorsiflexion on the patient's foot. So on the next page, you can see that we use TENS group. This on the left side is the TENS machine we used. And on the right side, we put TENS pad on both sides in SP10, ST34, SP9, GB34. So let's talk about our recruitment process and dropout. Our study began on July 7, 2020 and ended in December 31, 2020. Totally, 31 participants completed our study, whereas 15 in the Fuzhen group and 16 in the TENS group. So let's talk about our study's result. We will first talk about the participants' baseline data, and we will focus on use Fuzhen needles. What we found the primary outcome on the subjective pain intensive by VA score, and the secondary outcome by questionnaire survey, pressure pain threshold, knee angle measurement, and average walking speed. So this is the participant baseline data you can see on the figure. So we can see that age is over 65. So we talk about our primary outcome of subjective pain intensity. We use VA as score. So you can see the picture. We can see that our study demonstrates that the subjective pain reduced in both Fuzhen and TENS groups. So we can see that subjective pain had a significant decrease. And also see on the picture, it shows like a drastic decrease. But we can see that Fuzhen therapy is more significant and more effective treatment than TENS group on the picture. So that is our primary outcome. On the next page, we can see another secondary outcome. We use questionnaire survey as our secondary outcome. We use two questionnaires. One is for WOMAC scores and one is for reference index score. So in our study, the WOMAC score decreased in the first week and increased slightly in the second week. And the reference index, we also indicate a significant difference in the Fuzhen group. That means Fuzhen treatment efficiency persisted longer than TENS treatment. So about another secondary outcome, we try to use the pressure pain threshold, also known as PPT. We measure three places, one for quadriceps, another for gastrocnemius muscle, and third for patient insurance. We can see that in pressure pain threshold in quadriceps, there is also has increased after each treatment in the Fuzhen group. So that means but not found in gastrocnemius muscle and patient insurance. That means Fuzhen treatment is mainly for muscle, and no direct treatment exists for tendons. So another secondary outcome, we use the knee angle measurement. We test the active ROM and the PROM. Active ROM is on the left side, and the passive ROM is on the right side. So we can see that ROM, both of them increased after each Fuzhen treatment and decreased before the subsequent treatment. We found that means knee angle movement is corrected with patient's pain level. So another, we try to know the average walking speed. So on the line graph of average walking speed indicate that patient's average walking speed increased after each Fuzhen treatment. So that means muscle function improved and the average walking speed will increase too. So in our discussion, we know that trigger point is the main point. In our study, we share that when trigger point has found in both in OME patients, their capillary will compress and pain will present. After frozen treatment, it may become recurrence. But if we keep trying to keep use frozen treatment, about 7 days to 14 days, it will become a normal state, and trigger point will disappear, and so soon muscle pain will disappear too. So let's talk about the conclusions. Now I would like to sum up our result of this investigation. Fusion first can reduce pain, and fusion increase patient's physical function, and fusion has a beneficial effect treatment of knee OA. Thank you for your attention.
谢谢邱专家。现在我们要颁发感谢状给你。